Well, for more on vaccine distribution inequity, let's bring in Dr. George Benjamin. He's the Executive Director of the American Public Health Association. Welcome back to the show.
Thanks for having me.
So I want to first start by looking at President Biden's latest plan, which promises to make shots available to 90% of adults and put vaccination sites within 5 miles of residents' homes in about 3 weeks. How realistic is that, and does it go far enough to really address this issue of vaccine inequity?
Well, it's certainly a beginning. I think that obviously having them within 5 miles of people's homes is important. But 5 miles, if you're 70 years of age or if you're a very low income, it can still be a challenge. And so one of the things that we know is going to happen is that many of those sites are actually going to go into those communities and do pop-up vaccinations, and they're doing mobile vans. So they're doing a lot of things about bringing the vaccine into those communities, even though they're only 5 miles away.
So then in terms of the steps, the infrastructure and the coordination, even the health workers required to get this done, how will the states actually execute this plan?
Well, they've been working on scaling up the number of vaccination sites, the number of vaccinators, and where those sites are. So we have nationally a group of community health centers. These are clinics that are funded both by the private sector and by the federal government, who are actually in lower income communities. And by making sure that they get vaccine, which they had not had before, they'll be able to vaccinate their population. And by the way, they're trusted by the community, so they're much more likely to not have the vaccine hesitancy that we've seen in other communities.
And you raise an interesting point, because we hear a lot about community leaders and local leaders really playing a role. How does the Biden administration and local leaders address things like the grocery and pharmacy deserts where people don't have access? What's the plan for getting out into those neighborhoods that people can't get to, say, by car?
We've had a couple of the pharmacies. First of all, they're using Uber and Lyft, which are some of the ride services that we have here in the United States, to actually take people into their vaccination site. So they'll call them up, and they're partnering with some of our pharmacies to bring people in for their vaccinations. The other thing that they're doing is some of the community clinics have vans that are actually going into those communities with the vaccine that's easier to deliver. So the Johnson & Johnson product, which is one shot and you're done, and also can be stored in under regular refrigerator conditions.
Now, I want to look now at vaccines and census tracts. Break down what's involved and how it's working for states that have already taken this approach.
Well, there are states that have decided to go into a particular zip code, a mailing code area, and just vaccinate all the folks that are there. And if you do that, particularly in communities of highest need, then you're much more likely to vaccinate those communities that don't have access to the vaccine. In fact, I actually participated in one of those vaccine programs with my county health department by going into a community where there was high degree of COVID and a high degree of need.
And we are seeing states like New York and California really making more vaccines available even before the Biden plan comes into play. Is this opening up of appointments the best way to really prevent people from traveling to, say, from wealthier neighborhoods to get these shots that have been allotted for lower income communities?
Well, that's been a real challenge, and we know that continues to happen. A couple of things are going to help resolve that. Number one, there's been a marked increase in vaccine supply. So many of those individuals who have the ability to get online, get an appointment, and get to the more prosperous places to get vaccine, the vaccine will be easily available in their community, and therefore they will not feel a need to go into the low-income communities. But that still needs to be observed, policed, and enforced, because I think that's a problem with people jumping the line and going into communities where they really don't live in those communities.
So what are some of the other hurdles that you see in terms of accessing vaccines?
I think some of the biggest issues, of course, is the lack of ability to go online and make an appointment. We still have a fractured appointment system. Now, there are many states that are looking to try to resolve that, and the federal government is looking at least for the sites that they run, to have a central appointment system. But of course, this health system in the United States is very much a patchwork of health delivery programs. And so the challenge we have is really the underlying health system that we have.
Very quickly, we have about 15 seconds. Are people in minority neighborhoods any less apprehensive about the vaccine than they were at the very beginning when these things were first starting to be rolled out?
It's changing. We've made almost a 180-degree turn on that, and those minority communities are much more likely to get the vaccine because they now have seen it as safe and effective.
All right. Thank you, as always, Dr. George Benjamin there, Executive Director of the American Public Health Association. Thank you so much.